Hemoptysis or hɨʻmʒptɨsɪs is the expectoration of blood or of blood-stained sputum from the bronchi, larynx, trachea, or lungs. Differential diagnosis. There are many conditions involving hemoptysis, including but not limited to bronchitis and pneumonia most commonly, but also lung neoplasm, aspergilloma, tuberculosis, bronchiectasis, coccidioidomycosis, pulmonary embolism, pneumonic plague, and cystic fibrosis. Rarer causes include hereditary hemorrhagic telangiectasia, Goodpasture's syndrome and Wegener's granulomatosis. In children, hemoptysis is commonly caused by the presence of a foreign body in the respiratory tract. The condition can also result from over-anticoagulation from treatment by drugs such as warfarin. Blood-laced mucus from the sinus or nose area can sometimes be misidentified as symptomatic of hemoptysis. Extensive non-respiratory injury can also cause one to cough up blood. Cardiac causes like congestive heart failure and mitral stenosis should be ruled out. The origin of blood can be identified by observing its color. Bright red, foamy blood comes from the respiratory tract, whereas dark red, coffee-colored blood comes from the gastrointestinal tract. Sometimes hemoptysis may be rust-colored. Lung cancer, including both non-small cell lung carcinoma and small cell lung carcinoma. Sarcoidosis, aspergilloma, tuberculosis, histoplasmosis, pneumonia, pulmonary edema, foreign body aspiration and aspiration pneumonia, Goodpasture's syndrome, Wegener's granulomatosis, bronchitis, bronchiectasis, pulmonary embolism, anticoagulant use, trauma, lung abscess, mitral stenosis, tropical eosinophilia, drug-induced, bleeding disorders, Hughes-Stoven syndrome and other variants of Behar-Sectionase disease. Diagnostic approach. Past history, history of present illness, family history, history of tuberculosis, bronchiectasis, chronic bronchitis, mitral stenosis, etc., history of smoking, occupational diseases by exposure to silica dust, etc. Blood, duration, frequency, amounts of blood, large amounts of blood, or is there blood-streaked sputum, probable source of bleeding, is the blood coughed up, or vomited? Bloody sputum, color, characters, blood-streaked, fresh blood, frothy pink, bloody gelatinous. Accompanying symptoms, fever, chest pain, coughing, purulent sputum, mucocutaneous bleeding, jaundice. Imaging examination, chest X-ray, CT scan and 3D reconstruction images or CT virtual bronchoscopy, bronchial angiography. Laboratory tests, blood test, WBC, sputum, cells and bacterial examinations, sputum culture. Bronchial fiber endoscopy, treatment. Treatment depends largely upon the underlying cause. Many modalities of treatment can be used, like iced saline, or topical vasoconstrictors, such as adrenaline or vasopressin can be used. Selective bronchial intubation can be used to collapse lung in which the hemorrhage is occurring, also endobronchial tamponade can be used. Laser photocoagulation can be used to stop bleeding during bronchoscopy. Angiography of bronchial arteries can be performed to locate the bleeding, and it can often be embolized. Surgical option is usually the last resort, and can involve lobectomy or pneumonectomy. Non-euro small cell lung cancer can also be treated with erlotinib or gefitinib. References. External links, Hemoptysis at Notebook.